I have the pleasure of talking about one of the pleasures in my life, possibly a pleasure in your life, which is our pets. I am a 3-cat family, but pets have become even more important to us during the pandemic. They're probably the last person, I call them people, to listen to us, to give us affection whenever we want it. And they depend so much on us, which is very challenging. They have no voice, but yeah, we're their guardians. So I think of my pets as family, and I imagine that most of you do too. So I wanted to talk to you today about a really important topic, and that is planning ahead for your pets. I'm not talking about in the event of your mortality. I'm talking about something that could happen to any of us at any age. We're just getting finally, hopefully, through the other side of winter. The sidewalk could be icy. If you slip and fall, you could end up in the hospital overnight. And who's going to know to take care of the dog, the cat, the bird, the fish, the ferret, whatever your pet is at home that's expecting you to be there to take care of it. Let me tell you a little bit about myself. I work for a community social service agency called Search and Care. This is our 50th year of helping older adults remain in their homes. We primarily provide in-home social work and other free support services, such as a few financial supports. We can't make money appear where it doesn't exist, but we can help you budget better. And we also have some mental health supports. We have a wonderful pet program. And to us, it's PET, P-E-T, pets and elders together, because we try to help our clients' pets age alongside of them. You'll see on the bottom of the screen that it's not just Search and Care mentioned. I'll explain why. I often collaborate with other nonprofits in the community. Occasionally I collaborate with SMART, but these are two organizations I look to when I have issues for our pet families that I can't personally solve. The first one is PAWS New York, and PAWS stands for Pets Are Wonderful Supports. They primarily depend on volunteers to help do things when the owners can't, such as changing litter boxes or taking dogs for walks when the owner cannot. And then in the middle is Animal Haven. This is a very, very well-respected animal welfare organization. It is a no-kill shelter all the way downtown. And if you ever want to meet a bunch of people who are passionate about pets, they are indeed. And together, the three of us wanted to work together. And in fact, we got a grant from Petsmart to talk to you about the very thing I'm talking to you about today, which is advanced planning. So we can relate. Here's a picture of me on the right of your screen with two of my 3 cats. And to the left, this Sam's daughter and their family dog, Lily. We understand life with animals is extending your family. So we understand how important it is to you all. This is a little bit about working with Petsmart. Petsmart, as you probably know, is one of the big chain stores. They have a nonprofit arm called Petsmart Charities. And a year ago, they started a new initiative called Preserving Families, which is exactly what Search and Care is doing in trying to keep our clients, our older adults, people like you, to age alongside of our pets. And one of the ways we think of doing this is by making sure we try to address any impediments that might cause a rift or separation in that relationship. Certainly, if you go to the hospital and no one's home to take care of your pets, what could happen? Terrible, really sad things could happen. Your pets could be taken away from you. So there's lots of reasons why it's so important to establish an emergency contact for your pet. There are many things that are outside of our control all the time. And I think that's what we humans grapple with constantly, the little bit that we can control. But it's hard to control disasters, fires in a building, floods in other parts of the country. And there's a whole other conversation we could have about, are you prepared for an emergency? Meaning, if you had to evacuate, are you prepared to do that? And do you have a go bag for your pets? As I said, that is a whole other conversation. But here's something from the news that we've been watching, and kind of like this. We want to know about it, but we don't really want to know about it. The crisis in Ukraine. People being forced to leave their homes in order to spare their own lives, and they're fleeing with their dogs and their cats alongside of them. It's so, these pictures to me are very upsetting, as I am sure they are to you, but it is their reality. And my heart just goes out to all of these families in Ukraine. So, as I said, if you were to go into the hospital unexpectedly, what happens to the pet that's left behind? Here's somebody on the upper left-hand portion of your screen going in to try to rescue an animal that's left behind. I'm sure the animal's frightened, doesn't know who these people are. It's a very scary situation. And typically that could be somebody from a shelter coming to take your pet to a shelter. You may or may not get that pet back if you didn't surrender it. The surrendering means that you turn it over to the shelter. That would be a very terrible thing, but we understand why sometimes people have to do that. But unless you make advanced plans for your pet, this is what could happen. And then, of course, on the bottom right-hand side of the screen, you see a man in a hospital bed holding his pet. Well, we know people end up going to the hospital with their pets because they didn't do advanced planning. Hospitals cannot accept those pets unless it is a service dog. And even then it's a hardship. So yet another reason why we're hoping to encourage you to make advanced plans and start thinking about it today. So if you think of yourself as a responsible pet parent, you can call yourself a pet guardian. To me, it's the same thing. You're going to want to think about how do I take care of my pet? And then you're going to want to think about putting it in writing. And there's lots of reasons why. I personally am over the age of 60. And we start thinking about our own advanced plans. Who's going to be my healthcare proxy? So you do it for yourself. And if you're a parent and you have children, you're likely to think about them in terms of making your advance directives. But especially for your pet who depends on you and has absolutely no voice in the situation, it's even more important to think about your pet in terms of long-term planning. When's a good time to do it? Certainly not in the middle of a crisis. You can't think about doing anything other than possibly getting through the crisis itself. And I love this picture of this man with this cat, a beloved client of Searching Cares. This was a very big man who was so arthritic, he couldn't bend down to scratch his cat, to change a litter box, to feed his cat. So we were sending volunteers in all the time to take care of his cat. And he has said to us that there was nobody he could possibly imagine that would want to take his cat. So he said that he would like to have his cat euthanized when he died. Fortunately, the man died, and we love this cat so much. We found a second home for this cat, and this cat is treated like a king. So we know that cats can continue to have a really wonderful life after their owners die, as long as they're continually homed. It's a really sad thing for any pet to be left alone in an apartment for unexpected amounts of time. So part of this conversation is imagining our pets being continually loved and taken care of by people who can treat them properly. So today, I just want you to start thinking about this process. I'm not shaking my finger at anybody. I know this is not always an easy question to think about, but I hope you understand why it is just so important. What's the equation here? We could break it down fairly simply, I think. Here you have a person with a pet, and here you have an emergency contact. It looks like somebody who looks very professional, but you put them together and hopefully you can come up with a plan. From this view, it does look to me relatively simple. How do you get there? When you're thinking about who might be a great person to be your pet's emergency contact, think about who's ever shown interest in your pet. Maybe if you have cats and dogs, maybe there's somebody who loves cats more than they love dogs and vice versa. Or maybe you're lucky enough to have somebody who loves your whole tribe Wouldn't that be awesome? But it could be a neighbor. Neighbors often, so often help out in cases of emergency. It could be a friend. It could be a family member. It could be a volunteer. I had a conversation with a client who ended up having his ex-husband as his dog's emergency contact because he knew that that was one person who fiercely loved his dog almost as much as he did and would never have really thought about it unless he thought about the question, who's ever expressed interest in my dog? I know most of us think there's nobody who could ever take as good care of our dog or cat as we do, but there may be a time when somebody needs to. So once you've identified that person, raise the question, would you be willing to take care of my pet? And I suggest you start out by talking about it on a short-term basis. Like, for example, the example I gave of you slip and fall and in the hospital for maybe 2 nights. Could you do that for me? Could you feed my dog? Could you take it for walks? And then you discuss the logistics. Is this a cat that needs to have litter changed, a litter scoop rather, once a day? Is it a dog that's on medication? Those are all details we'll get to momentarily, but I think it's really important to put a lot of this in writing so that it's formalized, so that it's in both of your minds and it's a written agreement. Here are some of the really important details that you need to share about your pet so that your emergency contact really understands your pet's nature and your pet's needs. Who is the vet you take your pet to? When was the last time your pet was seen by a vet? Do you have copies of any of those bills and the procedures that were done? Copies of vaccinations? It's different with cats because since cats don't need to be groomed, we don't have to show Bordetella vaccinations, for cats. But it's also important to have cats seen. And one thing that certainly impacts both cats and dogs is dental disease. So I'm encouraging you to please don't put off taking your pets to the vet. What are your pet's favorite foods? Do they eat wet food? Do they eat dry food? Do they need a mix? Are they taking medications? All my cats are 17 now. We sort of sail through with no health issues until just recently, and we're making up for lost time, and now 2 of them are on meds. I'm very happily learned that they don't always have to be in pill form. You can get liquid form that tastes like, I was asked, what flavor would my cat like? And I said, what are my choices? And I was told, you can get chicken, you can get tuna, you can get salmon, you can get beef. So I'm experimenting, seeing which they like. And frankly, medicine is medicine. They don't want any of them, but they tolerate the liquid much better than they do the pill. But what is the schedule? Do you feed them in the morning? Do you feed them at dinner? For cats or dogs, is there food out all the time? Do they get fed from the table? And what about hygiene? If your dog gets walked, is it a morning walk, a midday walk, an evening walk? Does your dog sleep during the day alongside you? Do they snore? What is your dog like? What is your cat like? What do they not like? And are there warnings? For example, I know sometimes little dogs think of themselves as big dogs, and there's a lot of aggression. And certainly anybody who does not regularly walk your dog needs to know about that. Lastly, and very importantly, what is your view on euthanasia? Everybody I've talked to always say that I don't want my animal to suffer. I would rather see my cat peacefully and comfortably be put to sleep than suffer from an illness or any kind of harm. So I think that's something we all share. Do you feel that you want your pet cremated? Do you want return of ashes? All these things cost, but they all matter. And it's so important, once you have this relationship established and formalized, it's really important to share that information with a host of people. But I think amongst this list of people, there's 2 on here that are the most important. And I would say building management, number 1. If your building has a no entry policy, unless the resident has given permission, then it's important that you give this a document to building management saying, this is my dog's emergency contact. They have permission to enter my apartment anytime in order to take care of my pet. And I would say the same about a veterinarian, because if your pet is being taken care of by emergency contact while you're in the hospital, what if it suddenly develops diarrhea, God forbid, because it's so upset it doesn't see you, it has IBS, and then your emergency contact has to take your pet to the vet. It's good for your vet to know who you are in relationship to the owner and to the pet. One of the most important elements of making this work is making sure that your emergency contact has a set of your keys to your apartment. If they don't, this whole thing falls apart. And obviously, your contact has to be somebody that you trust well enough in order to give them a set of your house keys. This is a blank pet care emergency authorization form that we often give to people to help them complete or formalize the emergency contact relationship. And it's a document that you can give to your building as well. You fill in the blanks that are specific to you. It names you as the owner, and it authorizes the emergency contact, and it gives the emergency contact information. So the building management also has it. It would be great, for example, if something happened to you, your building knows about it, then they would know who to contact, not only your family, but they would also know who to contact to take care of the pet. That's a great way to ensure your pet has continuous care. This is a wallet card we developed for our clients. It says, help, I want you to know I have pets at home. And it's basically a lot of the same information you have on that very large sheet, which you really couldn't carry easily in your wallet. But the other good thing about both of these documents that carry information is that, for example, the wallet card could be blown up and put on your refrigerator. You can also take that other form I just showed you, the emergency contact authorization form, and put a copy of it on your refrigerator so that everybody who comes into your home would know who is there, who would be there to take care of the pets if necessary. I know it's not an easy process to go through, but what are the benefits to you as a pet owner that might not be so obvious? So I think the first one is that once you do it, it will ease some of your anxiety about what's going to happen to your pet if something happens to you. It's also knowing that your proactiveness on the part of your pet will help keep it safe, and that you were responsible in doing something positive for your pet. This is a plan that you are in charge of creating. You can make it as simple or as detailed as you and the emergency contact want it to be. It's not something that's being dictated to you. And it will ideally prevent you from losing your pet in this very big city, which has lots and lots of red tape. So hopefully it will make a difference to you and your pet, keeping that relationship as long as you possibly can. My information is here in case you'd like to contact me. I'm at Search and Care. I've given you my phone number. These are the other people that I collaborate with at Paws New York and at Animal Haven, my colleague Jenny and my colleague Carrie. And I want to share this quote with you because I just think it rings so true. I don't know if you know who Amy Sedaris is. She's a comedian that I just adore. And she says that sometimes losing a pet is more painful than losing a human, because in the case of the pet, you are not pretending to love it. It's simply love. Well, I know this is not an easy task, but it's so important. We get calls often from hospitals saying, we have a patient in the emergency room whose parrot is home alone and no one to feed it. And we don't know who this person is. We don't have access to this person's apartment. The only person we can think of in a situation like that would be the super. And sometimes supers are cooperative and sometimes they're not. So it kind of runs the risk, but all the more importance to continue to be a good and loving pet owner.